journalism and research. So what's the umbilical cord, Dr. Adefoye, between artificial intelligence and taking care of patient-doctor relationship? What's the relationship? And how do we balance the advantages and the disadvantages as highlighted by Dr. Enege?
Yeah, thank you very much. Well, most patients, excuse me, does not want to be treated by a system. They don't want to have the feeling that I'm being treated by a system, but I'm being treated by a doctor, human being. And there are two different things entirely. Now, if we have over-reliance on AI, it means patient will be treated by algorithm. Input the symptoms there, it means diagnosis. But the fact remains that the AI can get the context wrong, and in most cases get the context wrong. So what makes the difference between a competent doctor that a patient can trust is that there are times when the doctor may have to override the algorithm. Because the person you are seeing, there are some things that will tell you that you put into context that the AI may not actually interpret it very well. What I'm saying in a sense is this: that umbilical cord, the link is this, the care. The care, that's the human touch, put into consideration that you are treating might be not a machine. They have so many other aspects. And that's why we're talking about holistic treatment of a patient. In other words, you not take into consideration not just the biological disease, but biopsychosocial. So the other aspect of that patient, the mental, the spiritual, what have you. And that's why the family and social history is very important to family physicians. Family and social history, not necessarily disease condition in that family, but what is the impact of that disease, that illness on that patient? That's patient's well-being in terms of the social life, spiritual life, mental well-being. You want to elicit those things and then you're able to address all this. So the care, the compassion is actually your umbilical cord. That's why the patient feel in areas where they are using AI much, it actually affects the patient in terms of the mentality. Am I just being treated by the system or a human being? You understand? So, and that is why you know that when you are using AI, is over-reliance on AI weakens trust, right? Secondly is that the confidentiality too, which is one of the expectations of the patient from his doctor. That confidentiality too can be breached. Like this electronic record, for example, now, if somebody is really interested, they can hack into it, no matter the password or whatever you put. If they're interested in this particular patient, you want to know the patient history. You know, you can see some of our politicians leaving this country to go and assess healthcare outside the country. Some of the reasons because we fear that, okay, this particular condition you don't want people to know, right? And they believe strongly that if they are treated in this country, maybe somebody may just hack into it or somebody may just compromise, because it's there. So that is there. So the confidentiality, the trust, and whatever. So some of those things that are the ingredients what the patient expects from his doctor. So they may be lacking, they may be weakened if we have over-reliance or non-regulated use of AI in medical care.
Okay. All right, Dr. Adefoye, are there cases where AI-assisted systems have genuinely improved, patient outcomes?
Yeah, thank you. Of course, there are so many aspects. If you talk about AI, it has actually helped healthcare delivery, without doubt. It has helped healthcare delivery in so many aspects. So depending on the level of AI usage in that particular environment. For example, we are talking about electronic medical record, but there are some that have gone beyond using just EHR. But they might use AI scribe. That scribe can actually summarize the conversation between the doctor and the patient. It can actually write everything right down and summarize it and bring out a decision from your interaction. So that will reduce the time you spend on each patient. And secondly is that it gives the opportunity actually to focus more on the patient this time around, because you're not typing. As you're speaking, he's getting it. That's the scribe. You are not typing, so you can.
With our own intonation, and this technology are developed from foreign countries with the consideration of the manners of speech of Europeans. How would we be able to capture someone that speak English like a Yoruba man like me?
Let me tell you something. Like for example, now if you use Gemini, it's common. Yeah. No matter your intention, if it's English, it will pick it. Because the way they train this AI, you just go and check it up. The way they train it is multi-language. In fact, they take a lot of things into consideration because they know that the usage is not limited to one region. So they really tried in the training such that they are able to pick. Except you actually pronounce it so wrongly that you find it difficult, and then of course there's a way to highlight some of those things that you can fill in the gap as the case may be. So the scribe is there. There are AI tools that are used to triage. Okay.
What is the meaning of that?
That is to know the level of care that patient will need.
Okay.
So you not just go and burden the emergency or go and burden the outpatient department. It will triage such that to tell you that this person needs primary care, or this person needs a specialist care. So you don't go and waste your time in the PHC because you need a specialist care, right? So the AI will have, by the time you input the symptoms, it will tell you that this will need a primary care or a secondary care or what have you, as case may be. It will tell you. So there are tools that they use to triage. There are tools that they use to help in diagnosis, that help to tell you that, okay, this patient going for that will need this level of investigation. So it will assist you. So all those ones will shorten the time the patient will spend, and that's the big advantage. Secondly is that some of these AIs to help to now harmonize and synthesize all these findings and come with diagnosis. But that's why we just need the doctor aspect. That when I look at the patient and the complaint and the examination, what have you, you will look at, okay, this AI is actually guiding me rightly. Then you have to go in line, or you may have a reason to override in some cases, maybe adding additional things, but at least it will have shortened some of the things you will have done without the help of the AI. So the AI actually has assisted. Another aspect of the AI where you assist is that it promotes accessibility in the underserved areas, the remote areas, especially where you have manpower shortages. The AI can actually help, and has been helping. You see, even though in Nigeria we have not really deployed telemedicine to the level that we would have expected, but telemedicine too.
What is telemedicine for those that for the benefit of our listeners?
Well, it's just like telemedicine. It's like just doing medical care remotely.
Okay.
Yeah, it's just doing remotely. So the person may be in Kotangora and you are here in Ogun State, and then you are discussing.
And that compassion will be there.
Well, telemedicine is even fair in a way because telemedicine is not fully automated. You still have the human component. Okay. At the back end, there's still a doctor that you are discussing with, or there's a doctor who will still review your symptoms and whatever and give you feedback. Okay. You understand? So they may still ask questions and what have you. But there are some that are fully automated. That is just the whatever you are inputting, that's of your symptoms and what you are saying, that the AI will be giving you the. So that one is different. We don't have that much here now. So telemedicine can assist. So apart from that, medicine is in layers. You have the preventive medicine. In that preventive aspect, AI has been of much help because some of the information you need as a person. By the time you use chatbot, for example, now, put it there, it's going to give you all those information. You need, like a mother needs information on immunization for the child, can provide those information for you. You'll be empowered. There is AI help mom. So for a pregnant woman, go and help mom. Some of the questions you can ask can actually, give us this information. So for preventive care now, it can assist you. This is what you can do in this condition. This is what you can do in this condition. This can do. You understand? When you need a care, you need to see a physician. It will tell you. So you can say that way. What somebody will have actually ordinarily go to the clinic to get the information. If you don't want to be wrongly informed, the AI can actually give that information. You understand? So you can see that way it has actually reduced people visiting the clinic, for some things that can be actually solved on the internet through the use of the AI. So the AI has a positive impact too. It's only that how do we deploy it is the main thing.
The implementation. So Dr. Rile, you mentioned issue of digital record, the AI enhanced digital record, and there was this thought some years back that when I had the incidences of people dying when they arrive at emergencies due to lack of adequate record of the patients by the doctor even treating him. Maybe you are giving a medicine or treatment that will cause reaction and will lead to the patient death. How do we manage between getting the digital record of patients and their privacy? For example, can we have a system where at the punch of a button you get all the medical record of the patient irrespective of where he or she arrives at, medical facility arrives at, he or she arrives at, so that you'll be able to give the required emergency, and that treatment will not be counterproductive. So how can we balance between issue of privacy and digital medical record?
Okay, thank you very much. So the electronic medical records or electronic health records, so the medical records is supposed to be like a record for a particular facility.
Okay.
While when you talk of health records, it comprises all the components and can also link other hospitals.
Okay.
So what we are saying is that should be the aim, and I'm sure abroad that's what they do. So that when you have your hospital card, you are being treated, for example, in State Hospital Ota, and then you find yourself in Abeokuta and there is an emergency, just give them that your card number
or even your fingerprint.
Or your fingerprint, you can get to that.
Or your details.
So
get the
they will get everything because it is all linked together. We have not reached that place yet in most places in Nigeria. So that is the aim. When we get to that level, we'll be able to, whichever emergency, all your records is there. Of course, that also increases the risk of confidentiality. If hospital ABC can see all your records, that means risk of other people even hacking into it is there. But everything has risk. So the main thing is to make sure that those things, when they are put in place, they have some form of control. If you are not a medical personnel, you cannot go into those records. You understand? And then secondly, even in each of those hospitals, there are levels. For example, somebody who is, somebody who is which example do I give now? Somebody who is not a high person in the facility has limited access. In fact, a doctor, for example, has access to the patient's record, but if he's not the head of that department, he might not have access to other administrative aspects of that patient. So these are controls that are put in place to ensure confidentiality. But the truth is that if deployed properly, we can get to a stage where all those the records of people can be seen virtually anywhere they find themselves, especially in emergencies. And also, to add to what Dr. Adefuye said earlier, technology has actually helped a lot. I'll give a few examples. For example, we have what we call digital X-ray, for example, now. Digital X-ray compared to analog X-ray. What that means is that it is a computer-generated result, the X-ray film we are getting compared to the other one, and it's so clear that it makes it easier for a doctor to quickly diagnose. When you see the digital X-ray, it's so clear that you know what is wrong with the patient compared to the older one. Then there are some machines now that, for example, electrocardiograph, even digital X-ray, that the AI can diagnose, can say this is normal X-ray, this is normal ECG, and that helps a lot because doctors sometimes want these investigations not to diagnose but to rule out a condition. For example, a patient comes to me as a chest pain. I examine, I think no, this is not a heart condition. I think it's musculoskeletal, but just to be very sure, 100% sure, go and do this test. So when the test come out and say it's normal, then I'm rest assured. So I don't need to start looking for somebody or so those machines help. We know a lot of digital machines are all there, so they are helping. but definitely we need to harmonize this care.
In addition to that, how do we balance between the two extremes in terms of the integration of technology or AI in a doctor-patient relationship? There are some patients or doctors that don't want to hear anything about AI when it comes to medical care. There are some medical doctors that don't want to hear about it. There are some medical doctors, they depend so much on it that even if they want to ask about
simple question,
they ask AI. So, and there are some they don't even want to have anything to do with it. So how do we balance between the two extremes?
Yeah, thank you very much. So like you said, two extremes. So the two extremes are not good. Change is the permanent thing. Change will come. And the truth is that, some people are computer naive. They don't want to just improve. They just want to stay like that. But whether we like it or not, the world is moving. So there should be a balance. I'll give an example. And I'm sure the audience, all of you here, you see Dr. A in the hospital. And he types in the, he says, what's your complaint? He says, fever, headache. And he types in and tells you, I've typed into the computer, I'm waiting for diagnosis. And then you go to Dr. B, you say fever, headache, and he says, bam, this is your diagnosis, bam, this is your treatment. Which doctor will you want to go and see? So the doctor should know that. But again, you go to a doctor, he doesn't believe in AI, doesn't believe in computer, old-fashioned, you use his paper, your card, and then you come after 2 years and you can't find your records. You can't remember anything.
You need to pay more then. All the tests that should have been acted on.
Yes. And then also even some things that maybe discovered, maybe some reaction to some drugs that the doctor discovered that you don't even remember again. And now he doesn't have the record. He also has forgotten. He can now give you that drug and then start managing that reaction. And then you go to another patient, another hospital. Your record is last 10 years. They click a button and everything is there. So we need to, you can't just be in the extreme. We need to manage that. This is digital world. We need to move with the age.
Okay, Dr. Adefia, do you think medical schools should begin formal AI training for healthcare professionals?
Yeah, thank you. Well, I think of recent there was a conference on it by Nagem Lipi in the state here, and the facilitator make it clear, because it was one of the questions. Personally, I was interested in that particular lecture, and because I'm doing a study on the AI among doctors, that is how ready are we to use AI in Ogun State as doctors. I'm presently doing a study on that, and of course the result is already very clear to me. The majority are now actually ready. Yeah. So it was part of my questions to the speaker that day. So he now told me something that the NUC has actually empowered its institution to put in their curriculum what they think is missing. And in OU, they've actually put AI and some other things that he listed as part of the curriculum. So because it's a digital world, we are digital age, there's no way you can graduate any doctor now that will not understand the use of AI in medical care. It will be counterproductive. So they'll be giving that leeway by NUC. So it depends on those institutions now to put it. So what it means is that they've recognized that gap and they're doing something about it. So most just definitely now will input in their curriculum, both at undergraduate and postgraduate, because it's not only at undergraduate level. Even at postgraduate level, AI was not there before, but now they are putting it, and there are so many continuing medical education that they are being generated that more doctors to attend to improve their digital savvy so that they can be in tune using AI in medical care. So it's something that has to be in the curriculum, both at undergraduate and postgraduate, moving forward. If not, we'll be left behind. Thank you.
So let's look at the area of policy. Although you mentioned in the passing the effort of the National University Commission liberalizing curriculum development, allowing individual tertiary institutions to be creative in developing curriculum that is local, that will meet local needs. So let's look at the issue of digital divide. when we talk about most of this technology, AI-enabled technology, they are not produced in Nigeria. That's one level of divide, ownership. In terms of proficiency of use, you just mentioned that you are conducting a study about the readiness of medical doctor when it comes to the integration of artificial intelligence in medical care. How proficient are they? You've partly answered that question. So what policy framework can stakeholders adopt in ensuring we maximize the benefit of AI when it comes to medical doctor-patient relationship?
Thank you. Well, the first thing I will say is to correct the notion that we are not developing AI tools here. We are actually developing.
Really?
Yeah. In fact, there are two AI I can tell you, and I think, is it Adacom, or they clarify. There are so many AI that are indigenously developed in